Thank you very much. This is a very important session, mainly because it's the last session before your lunch. So I think you're very eager that this finish early. The title of this session is Perspectives on the Patient at the Heart of Care. Panelists will be Tirupathi Karthik, is a CEO of Napier Healthcare Solution Private Limited since November 2016. A leader in healthcare IT space. I think you have a lot of experience across Asia, Middle East, and USA. And you'll be speaking on the Napier's RPM, which is the remote patient management. And you also cover the buzzword nowadays, which is IoT, Internet of Things, AI, and also machine learning, which I will assume you'll be covering Dr. Google as well, which a lot of people are using.
Good morning, Honorable Deputy Minister of Health, Dr. Lee Boon Chai, distinguished guests, ladies and gentlemen. My endeavor in the next 10 minutes is to convince you that technology can actually provide a lot of value in the healthcare system without having to make fundamental changes to the way the healthcare system is structured. Before I do that, let's quickly examine in the last few years some of the winds of change that we have seen in the healthcare industry as a whole, if you look at it. Starting from the right, acute care has been under a lot of pressure in many countries because the paradigm has changed. It no longer is the expectation of the patient that I should come to you, but rather the expectation is deliver me care where I am, which is what I call as care anywhere. At the same time, especially with the elderly people, the need for home care is rising very rapidly. I just saw a report yesterday which says globally the home care segment is looking at a growth of something like 14 to 15% CAGR, which means that in the elder care and the long-term care segment, that is the fastest growing segment for a variety of reasons. Especially in Asia, it is so because of the stigma associated when one sends their parents into a long-term care facility like a nursing home or an old age home. It's almost like sinful for someone to do that. Because of that and also some of the other factors which we can talk about later. And then there is residential care, which is really the last line of defense. And that's now coming up because a lot of countries globally and in the region are going through a demographic shift. Singapore, for example, 25% of the population will be over the age of 65 in a few years from now. Consequently, the healthcare budget is going up. Likewise for Australia, likewise for Hong Kong, and not very surprisingly also for China, which is expected to have 440 million people over the age of 65 by the year 2050. So just imagine the burden of elder care on the healthcare systems. There is a choice to be made of taxation and building nursing homes versus doing home care and day care, and how do you co-opt the family and so on and so forth. And lastly, mobility. Mobility is at the opposite end of the elder care spectrum in many ways, because mobility is something that all millennials identify with. My own daughter wakes up in the morning and the first thing she does is turns over to the bed and picks up the phone to see who's messaged her in the last 8 hours that she was sleeping. And that means that the way millennials consume information and the way millennials deal with information is changing. They expect the mobile to be the first line of defense. Consequently, as they enter the industry for healthcare services, you have to respond to that. You have to make information available to them in the manner of their choosing and not the manner of your liking. So these are some of the things that we are seeing in the industry today, and these are all ubiquitous and pervasive. These changes are here to stay, and they will impact the way we lead our healthcare services into the next generation. How do we do that? How do we respond to some of these? So one of the things that we have done is we look at delivering care anywhere, or rather enabling healthcare services providers to deliver care anywhere. So just take an example. Let's assume that there is an oncology center in KL, and it has all the super specialized physicians and the surgeons and all of them available. How do you make the maximum utilization of their capability and expertise throughout the country? And that is possible if I could project their capabilities into the hinterlands, into the villages, and into the remotest corners where the first line of defense, which is the primary care physician, is then trying to help a patient into the healthcare system. So how do we do that? It is done through a few technical things, which I'll try not to talk of. I try not to use a lot of technology words and jargons in explaining some of these concepts. So there is this thing called the IoT, or the Internet of Things, which is enabled biosensors, and there are apps, and we can do assessments and activities at the site, in the home or in the clinic of a primary care physician, and we can do teleconsults. And on the other side, we have the clinical decision support, the real-time alerts, and the analytics related to outcome, which the speaker just before me also mentioned. So we can do all of that without incurring the physical cost of travel or setting up infrastructure in the remote place. So you could technically have a patient in the primary care physician in, let's say, Johor, being teleconsulted by someone in KL, and then based on a teleconsult, you could bring that person over to KL if needed, and that too, by the time they come here, the information is available to the physician. One of the biggest frustrations that most patients have is as they go through our health system, which in most countries is extremely disjointed, there is a primary care physician. From the primary care physician, you go to a specialist. From the specialist, you go to a surgeon, and from the surgeon, you go to a rehab, and from the rehab, eventually you do come back to your family physician or the primary care physician. And at that point in time, the patient, having traversed through the entire healthcare system, has this unfortunate experience of having had to explain to every physician at each time what happened to him or her. And that's very frustrating from a patient standpoint. And then on top of that, they have all these stacks of reports that they carry along at each stage. How might we, in that case, use technology and bring value into the system by simply enabling a referral network, which is, for most practical purpose, I would say EMR agnostic, which means it does not depend on who uses what EMR, but is still able to take that information, push it around in the healthcare system in that continuum, and making sure that the care is delivered appropriately by each person in the healthcare system. And I think that's the value we are talking of. How do you manage the patient data? How do you manage the patient experience and eventually the outcome in a seamless manner using technology? And that's possible today with mobility, with cloud, and with remote patient management, some of these softwares that can be implemented today. We also discussed about artificial intelligence. But before I talk about artificial intelligence, it's a very popular point of discussion in most forums these days. The point that I want to talk about is today, whether we take Malaysia or we take any other country in the world, the biggest stress is on the availability of nurses and nursing care expertise in every health system. Most of them will tell you that their nurses come from a certain country in Southeast Asia. Right? And that's, I go to Saudi Arabia, I go to Dubai, I have been in Africa, I've been in other countries, including Australia and other places. They are all from another country, which means you have lack of skilled nursing expertise in the country. Now just imagine, what does a nurse do in their daily task every day? They are going back and forth to the patient's bedside a few times and coming back. And many a times these visits result in having to record some data or the other. And then they either record the data on a piece of paper, come back to the nursing station, or use a computer on wheel and then enter that data into the system. But what if I could have that nurse interact with the back-end systems through a voice interface? This is what we're trying to do in what I call internally as Kill the Keyboard initiative. In my view, the keyboard is the most inhibiting factor to productivity in a healthcare enterprise. What if the nurse could just talk to a mobile and say, I want to move this patient from this bed to another bed, and what it does, in the way we have implemented it, there is a Google Voice recognition in the front end. It then goes in, recognizes that voice, converts it from the voice to the, instructions into the HIS or the EMR at the back end. And once the patient is moved from bed 1 to bed 2, for example, then it comes back and says, hey, I have done it. And then the Google engine again translates it from text back to speech and tells the nurse that, yes, I have done it. This could be applied for a lot of the scenarios that we have spoken on the slide. For example, the bed status, the vitals capture. Today in Australia, one of my customers, what they do is they actually use the vitals by the bedside of elderly patients, and they just take the vitals, and those readings are transmitted through a Bluetooth connected to an IoT, and it directly goes into the EMR of that patient. What that does is, per patient, it saves about 2 to 3 minutes of data taking, entry and re-entry, avoids a lot of human errors and so on. So this is what is the power of a speech interface rather than a keyboard interface. And come back to what I was saying earlier, which is I want to kill the keyboard, because that is what inhibits people from interacting with the application. If you ask, okay, I was waiting for the bell there. So if you ask a doctor, any doctor will tell you their greatest gripe on technology is that they have to use unusable systems. Usability is a big issue. But with voice, suddenly usability is not an issue anymore. Just imagine, the other technology we have is what I call as interactive EMR. A doctor meets a patient and says, well, looks like you have a broken leg. I want to send you for an X-ray. Meanwhile, you have a painkiller. As the doctor turns around, if the ambient speech can detect that and put that into the EMR record, all that the doctor has to do is to look at the scratch pad and say, well, that's okay. Everything is fine and accept. That is available today. We deliver that today. And look at the kind of productivity that increases and the value that it brings into the system. And that's what I submit to you technology can do without being very invasive in many cases. So what do we wish for? We wish for superior patient engagements for our customers. We wish for improved outcomes. And in all, a happy healthcare system. Thank you very much.